It's a startling reality. Despite consuming fewer ultra-processed foods, Americans aren't making meaningful strides toward healthier eating habits. Why is that? Let's dive into the details and uncover what's really going on. According to data published by the Centers for Disease Control and Prevention, CDC, about 55% of the average American's daily calorie intake comes from ultra-processed foods. For children, the numbers are even more alarming. 62% of their calories come from these foods. What makes this statistic particularly concerning is that ultra-processed foods often contain high levels of sugar, unhealthy fats, and artificial additives, which can contribute to chronic health issues over time. And while consumption of these foods has decreased slightly over the past decade, it hasn't translated into an overall improvement in dietary quality. But here's where things get complicated. Not everyone is equally affected by this trend. Income plays a significant role in shaping dietary choices. Families with higher incomes tend to consume fewer ultra-processed foods, deriving only about 50.4% of their calories from them. On the other hand, families living below the federal poverty line rely heavily on such foods, with 55.3% of their calories coming from ultra-processed options. This disparity highlights a deeper issue: the affordability and accessibility of nutritious food. Processed foods are often cheaper and more convenient, making them a default choice for many low-income households. This brings us to another critical point: public health policies. Health and Human Services Secretary Robert F. Kennedy Jr. has been vocal about the link between ultra-processed foods and chronic illnesses like diabetes, heart disease, and obesity. He advocates for increased funding for nutrition research and emphasizes the importance of prioritizing whole, minimally processed foods in our diets. These efforts aim to shift societal norms around eating habits and improve long-term health outcomes. However, conflicting government actions have raised questions about how committed policymakers truly are to these goals. For instance, during the Trump administration, certain initiatives seemed to work against nutritional progress. In one notable move, grants that supported farmers supplying fresh produce to schools were cut in March. Additionally, the administration proposed slashing funding for the Supplemental Nutrition Assistance Program, SNAP, by 20%. SNAP provides financial assistance to low-income families for purchasing groceries. So reducing its budget could make it harder for vulnerable populations to access healthy food options. And this is the part most people miss. Policy decisions don't exist in a vacuum. They ripple through society, influencing everything from school lunch programs to grocery store shelves. When budgets for programs promoting whole foods are reduced, it becomes harder for families, especially those already struggling financially, to make healthier choices. So where does this leave us? Is it enough to simply reduce our reliance on ultra-processed foods if we aren't actively replacing them with nutrient-dense alternatives? How do we address systemic barriers that prevent equitable access to healthy foods? These are challenging questions without easy answers, but they're essential conversations to have. Do you think current policies are doing enough to promote healthier eating? Or do you believe there's room for improvement? Share your thoughts in the comments. We'd love to hear your perspective.